All right, good day, everyone. So, for today's discussion, I will be talking about Chapter 10 Safety Practices in Outdoor Recreation. So, we are through discussing Chapter 9, which is about the mountaineering activities. So, we are done talking about trekking and hiking, as well as the camping. So, it is now time for you to know the things that we need to do during outdoor activities because our body is vulnerable to this kind of injuries. Ayan. So, kailangan malaman natin kung ano yung mga dapat natin gawin in order for us to take good care of ourselves, 'di ba? So, lagi ko sa inyo sinasabi that always take good care of yourselves because no one will ever will. Ayan. So, the only person that you can depend on this lifetime is you yourself. Okay? So, ikaw lang po, no? So, paano kapag napag-iwanan ka ng ka-members mo and nahulog ka sa bangin, 'di ba? So, sino ang mag-a-apply sa iyo ng first aid, 'di ba? So ikaw lang din naman. Okay po. So mas lamang po ang may alam, parang ganun nga. Okay? So this chapter will deal with medical injuries and illnesses commonly encountered in the outdoors and how one can help others in these situations. Discussions will also include aquatic and environmental hazards that potentially might be the cause of the illness and injuries. And we all know that first aid administration is a life-saving skill that requires training. Okay, so it has to be noted that the discussion in this chapter should not take the place of the first aid training, but rather serve as basic information and guide. Ayan. So disclaimer lamang po no sa mga students that this topic is not going to be a first aid training because first aid training is being conducted by professionals, first aiders, yung may mga training and experiences po talaga. Ngayon, let's serve as this will serve as your basic information and guide only. Okay? So, the first question is, what should one do when faced with a medical emergency situation? Ano nga pa po yung unang nating gagawin kapag naka-encounter tayo ng medical emergency situation? So, the first thing, no, the very first thing that you will do during an emergency situation is stay calm. Huwag magpapanik. Kumalma lang po. Okay? Because panic is the worst enemy of any emergency situation. Okay po, it even makes a bad situation worse as this spread to others as well. It does not allow one to think. So kapag nagpapanik tayo kasi hindi natin alam kung ano yung gagawin natin, ayan, so walang papasok sa isip natin guys. Magpapanik tayo, aligaga tayo, yan, kinakain tayo ng ating emotion. But if you know or alam mo kung paano mag-apply ng first aid, there is no reason for you to panic. Okay pa? Now, during this kind of emergency situation, you need to remember the DRS ABCD. Yeah. So the DRS ABCD stands for dangers, R for response, S for send for help or shout for help, A for airway, B for breathing, C for compression or CPR, or yung tinatawag natin cardiopulmonary resuscitation, and letter D, defibrillator. Isa-isahin po natin. Pag sinabi po nating danger, check for danger to yourself, bystanders, and the patient. So, in order for you to be safe, you need first to know if the location of the patient is safe enough for you to apply first aid, 'di ba? Kailangan iligtas mo muna yung sarili mo bago ka po magligtas ng ibang tao. Naintindihan? Yan. So, if you can now assure that the place is safe for you to conduct an emergency aid, no, or yung mga basic life support na ginagawa, you can now bystand doon sa gilid ng pasyente, and now you're going to proceed with letter R. So pag sinabi nating letter R, it means response or responsive. So you're going to check for a response. You ask the name, squeeze the shoulders or tap the shoulders. Yan. So by asking, ma'am, sir, are you okay? Are you okay? Can you hear me? What's your name? What's your name? Ayan. So ganun po yung mga questions na dapat nating itanong para po alam natin kung conscious po ba yung pasyente. Alright? Because there are two telltale sign in order para po kapag kayo ay magkakandak ng emergency. So we have the unconscious and the not breathing. Pag sinabi po natin unconscious, ibig sabihin the patient is unconscious, walang malay, pero humihinga. Okay, hindi walang malay pero humihinga. So, ano po yung gagawin nyo? Do not touch the patient. Do not move a single part of the body ng pasyente unless otherwise the neck and the back is being supported to avoid mga medical conditions pa. Okay, baka kasi mapasama pa yung pasyente. Alright? So pagka ganun. But if the patient is not breathing, ibig sabihin, unconscious, walang malay, and hindi humihinga. So that is now the time for you to conduct CPR. Okay? So going back po dito sa ating DRS ABCD, letter S stands for send for help or shout for help. If you are the only person around the vicinity or around the incident area, so of course you will be the one to call for help. That is why it's very important for you to have emergency hotline sa inyong cellphones. Okay? So yung sa PNP, number ng PNP, number ng hospital nearby, and of course BFP, 'di ba? Just in case of emergency, hindi ko naman sinasabi na kailangan ka-chat nyo sila or kailangan ka-text nyo sila lagi, 'di ba? So for example, may kumatok ngayang kulto sa pintuan nyo. Yan, 'di ba? Katulad ng nangyayari sa Mindanao. So madali kayo makakapagtawag ng barangay or ng tanod o kaya naman ng pulis para magresponde, 'di ba? So just like for example, kapag kayo naman ay yung kapitbahay nyo nasusunugan, you can easily call for help because you have hotline or yung mga hotline numbers ng BFP. Okay? And for emergency, you can also call for help, 'di ba? Sa mga ambulance sa hospital nearby. So napaka-importante po na meron tayong mga numbers noon. Let's make our cell phones useful. Next one. Pag sinabi po naman natin na pag sinabi naman po natin na airway, pag sinabi nating airway, you're now going to apply the look, listen, and feel approach. Pag sinabi nating look, listen, and feel approach, ibig sabihin, you're going to check if the patient is breathing. Okay? Now, look, listen, and feel approach is a way of telling if the patient is breathing. So, you're going to place your ear towards the nose and the mouth of the patient, and your face is facing to the chest, 'di ba? Because if we are what do you call this, if we are lying down, 'di ba? If we are lying down, kapag humihinga tayo, our chest performs a rising and falling movement, 'di ba? So that indicates the patient is breathing. Okay? So pagka ganun po, pag yung pasyente po humihinga sa loob ng 10 segundo, kasi ang normal na tao po or ang normal breathing rather, twice po yung pag-rise and falling na movement ng ating chest. Okay, 2 beses sa loob ng 10 segundo. So if the patient is not breathing for 10 seconds, you now call for help, 'di ba? Next one is breathing. Yan. So magkasama yan yung airway and yung breathing. Yan. Kapag yung pasyente po ay hindi humihinga, it's now time for you to conduct CPR or yung cardiopulmonary resuscitation. Okay? So paano po ba kinakandak ang CPR or yung cardiopulmonary resuscitation? So you're going to perform 30 chest compressions and 2 ventilation in 5 cycles. Okay? So ibig sabihin 30 chest compressions, 2 breath, and in 5 cycles. Okay? So mamaya papakitaan ko kayo kung paano yung kung paano yung technique. Yan, mamaya may bigay akong sample dyan sa inyo. Okay? So kaya po kailangan sa 1 minuto makapag-perform kayo ng 100 to 120 compressions. Okay? Ulitin ko, 30 chest compressions, yan, 2 breath and 2 life-saving breath, and also in 5 cycles. So 5 beses ang uulitin. So kailangan sa 1 minuto makapag-perform kayo ng 100 to 120 compressions. Okay? So si defibrillator po kasi very lang naman siya kasi minsan gumagawa na nito is yung mga nasa ambulance o kaya naman kapag nasa hospital na siya. But if the respondent is a first aider, matic na. Meron siyang dalang-dalang defibrillator. Okay pa. Now, I'm going to show you kung paano po ina-administer ang CPR. But first, let's have the definition of cardiopulmonary resuscitation. So it is a life-saving technique that is administered when breathing and heartbeat of a person stopped. Yan. Such as during a heart attack and drowning. So, di ba po, kapag nakakita tayo ng mga pelikula, pag nalulunod, kailangan um, mag-perform ng CPR, di ba? Mag-perform ng cardiopulmonary resuscitation. So, in that way, you can also help the patient to save his life. Okay? So napaka-importante po, class, na meron po tayong alam sa mga ganitong bagay kasi ang aksidente po hindi po natin alam kung kailan po at saan mangyayari. Okay? So napaka-importante na meron po tayong alam sa kung paano po magligtas ng tao. Kasi the more na hindi po nakapag-responde ka agad, the more na nawawalan po or nababawasan ng chances yung tao na mabuhay. Okay? Now, so in CPR, meron po tayong tinatawag na CAB or yung CAB. Pag sinabi nating CAB, it stands for compression, airway, and breathe. Yan. So sinabi ko na to sa inyo kanina. So, first aid, yan. So, call for emergency number, check vital signs, lift chin and check breathing. So, ito pala guys na lift chin and check breathing. You're going to tilt the head, yan, yung parang patangad, something like that, to clear the airway ng throat para medyo, para walang sagabal or makapasok yung hangin na ibibigay mo sa kanya. Alright, so give rescue breath, perform CPR, and repeat step 4 and 5 until help arrives. Now, dito po sa sunod na picture, may makikita kayo dyan sa chest compressions na yung adult, meron po tayong tinatawag, you're going to press down for at least 2 inches. Ayan. So sa child, of course, 2 inches din. And for the infant, 1.5 inches po ang kailangan yung i-press down. Okay? Yan. So pag adult naman, you're going to use your dominant hand being supported by your left or right hand. 'Di ba? So pati ba naman sa pagbigay ng rescue or pagbigay ng first aid, sarili mo lang yung ka-holding hands mo. Char. Next, sa child naman, para po kontrolado pa rin natin yung pressure, syempre kasi bata pa yon, you're just going to use your dominant hand. Okay? And for the infant, 2 fingers lang po. Now, saan po ba ang pinaka-correct position ng pag-conduct ng CPR? So from the nipple, no, sorry to say this, from the nipple of the patient to the center and then lower part, yung malambot po na bone sa baba ng ating ribs. Hindi po mismo sa ating ribs, okay? Hindi po mismo sa ating ribs. Kasi it's very walang may tutulong 'yun. Yung matigas 'yan. So kailangan po dito sa may baba ng ribs 'yan. Diyan po magkakandak ng CPR. All right? Next one. Okay, so let's now proceed with the first aid of common emergencies in outdoor activities. So ano po ba yung madalas na nakukuha nating injuries kapag nasa outdoor activities tayo? Or paano naman natin to magagamot, di ba? So the term first aid refers to administration of care to prevent deterioration of the victim, to aid recovery, and to preserve life. Yan. So katulad ng sinasabi ko sa inyo kanina. On a technical level, it is not identified as medical treatment and should not be of simple procedures and an application of some common sense. Okay, so hindi siya medical treatment guys na kailangan pang may hihiwain or something like that. So paunang lunas nga po, 'di ba? So habang wala pa yung ambulance, you perform now CPR, no? Para malay mo kasi pagdating na ambulance, dead on arrival ang pasyente kasi walang nag-perform ng CPR. All right? Now, so common injuries and illnesses in the outdoors. Number 1, we have the cuts, scrapes, and punctures. So ito po, nakukuha po natin to saan? Sa rock climbing natin, cutting ourselves from a knife accidentally, and also stumbling. So ano yung mga dapat nating gawin? I did not provide any pictures kasi baka madiri kayo. Yan, so hindi siya kaaya-aya. I know naman, ito yung mga sugat guys, yung mga hate o yung mga nakutsil yung part ng katawan natin. Yan, di ba? O, na na kaya agad kayo. Now, the first thing to do is to clean cuts with soap and water. Yan, so if bleeding, apply direct pressure. By the way, if you clean your cuts with soap and water, make sure po to avoid contamination, make sure na running water siya or flowing water. Alright? So, hindi po siya yung stagnant water na nasa tabo lang or planggana. Kailangan running water. Next is, if wound is on the arm or leg, raise limb above the heart. Ayan, para po maiwasan yung excessive bleeding. Alam nyo naman po that excessive bleeding can lead us to death kapag hindi po kaagad na agapan. Alright? The next one is what we call the sprain, strain, and fracture. Can you still remember the 5 acute injuries way back in grade 11? Ayan. So the 5 acute injuries are what we call sprain, strain, fracture, dislocation, and concussion. Right? So itong si sprain, strain, and fractures, nakukuha po ito. And also itong mga acute na to, nakukuha po during sports. Pero also, um, kapag po kayo ay umakyat sa bundok, yan, na hindi po na kayo nakapag-stretching o kaya naman po punit na yung mga ligaments nyo, it can worsen your situation. Alright? So bakit? Pag sinabi kasi nating sprain, these are injuries that involve the stretching or tearing of ligaments. So pag sinabi naman nating ligaments, it is the cord of tissue that connects, what do you call this? That connects two bones together. Diba? So kadalasan po ang mga na-sprain is yung mga athlete natin. Saan nila yung nakukuha? Excessive training days. Yan, hindi nagpapahinga. Kulang yung pahinga. No? Inaabuso yung katawan. And also, nakukuha din yan kapag lagi tayong napapatapilok. Yan. So alam niyo po ba yun? Napapatapilok. Yan. 'Di ba? Napatapilok kayo sa kalsada, tapos deadma lang, kunwari walang nangyari kasi maraming nakakita. Tapos pagdating doon sa dulo, wala ng tao sa kaaaray kasi masakit, tiniis mo lang, 'di ba? So pagka ganun po, pag masakit ang ating ankles, na sprain mo 'yan. Okay? Pag sinabi naman nating strain, it is the pulling or twisting of muscle or yung tendons na nagko-connect ng muscles natin sa ating bones. Saan natin nakukuha at paano natin nakukuha ang strain? Nakukuha natin ang strain kapag po tayo ay nag-conduct ng activity na hindi po tayo nag-stretching or hindi pa tayo nag-stretch. Ay, hindi tayo nag-warm up. Nabigla yung muscles natin. All right? So napaka-importante po ng flexibility because flexibility doesn't only care about our bones but also our muscles. Okay? It helps our muscle to get warm para po maging ready sa kung ano man po ang activities ang inyong gagawin. Alright, for example, namiesta kayo. Yan, 'di ba? Namiesta kayo, 3 bahay or 3 barangay ang pinuntahan niyo kasi sabay-sabay. Okay? Sa iba't ibang lugar. Yan. So syempre, sobrang lakad niyo para lang sa lumpia, para lang sa igado o kaya naman para sa suman. Yan, nagka-strain kayo. Okay? So, lesson learned, bago mamiesta, mag-stretching muna. Joke lang. Okay. Next one is fracture. So itong fracture, this is tawag dyan, the discontinuation of our bone, I guess. Kumbaga para ito yung bali ng bones natin. I just forgot the 2 types of fracture, but I will not include that naman in your exam. Okay? So also the dislocation, nangyari yan sa mga joints natin, and of course concussion. So si concussion, eto na siya. Okay. Concussion is a traumatic brain injury that is often caused by a blow or bump to the head or body. Yan. So when you accidentally fell on the floor and you accidentally bump your head to the wall o kaya naman to the floor, no, depende po sa impact. No, according to the American study of neurology, I just forgot the agency or the organization. They say there are 3 types or there are 3 categories of concussion. So meron tayong tinatawag na grade 1, grade 2, and grade 3. Yan. So pag sinabi natin grade 1 concussion, ibig sabihin mild. The patient is conscious, buhay, or should I say may malay ang pasyente. Pero babalik ang kanyang pakiramdam or bubuti yung pakiramdam niya in less than 15 minutes. Yan. Grade 2 category of concussion is what we call naman moderate. Yan. So may malay ang pasyente pero more than 15 minutes bago po ulit bumalik sa dati ang kanyang pakiramdam. Okay? So this is not included in your book and also sa ating PowerPoint. This is an additional information. So ano naman, what we call that, yung grade 3 is what we called severe. Yeah, the completely loss of consciousness. So ibig sabihin walang malay yung pasyente. Okay pa. So pagka ganyan po, alarming na po 'yan. You need to bring the patient to the hospital. All right? Yeah. So cuts and bruises may be seen on the head or face. Some lose consciousness or forget what happened before the injury. others do not. So yan po yung sinasabi ko, depende po sa impact, depende po sa lakas ng pagkakabagok ng ating ulo. That is why sa mga riders dyan, no, it's very important for you to use your helmet, your safety helmet. No, magsuot ng helmet hindi dahil takot ma-checkpoint or matikitan. Magsuot ng helmet kasi takot kayo ma-aksidente. Okay? Ang checkpoint na ano yan, nababayaran yan. Na-predict yan. Minsan nga may mga tips pa kayo nakukuha na may checkpoint sa kanto, may checkpoint sa sentro. Pero ang aksidente, alangan naman na, o ikaw mag-helmet ka kasi ma-aksidente ka mamaya. O, di ba? Wala naman pwedeng ganun. So kapag may nagsabi sa iyo ng ganyan, matakot ka na. Di ba? So walang ganun. Kaya po, every time, please be safe. Wear your safety helmets. Alright? Next one. So how do we treat cuts? No? Number one, of course, treat cuts. Buhusan ng tubig. Yan. If possible, flowing water. Apply ice para po may bawasan yung pagkabukol ng ating ulo. Rest until symptoms disappear. So ano po ba yung mga symptoms? Number one, vomits repeatedly, suka ng suka. Yan. So the pupil become unequal. One looks agitated or confused. One is unconscious or passes out. Malala yun. One feels very drowsy. And there's a pain in the neck. There is a slurred speech. One experiences seizure, and in worst scenario, pwede kang makoma. Pwede kang makomatos. Depende po sa pagkakabagok mo. Alright? Yan. The next one is the blisters. Ayan. So a result of ill-fitting footwear. It is especially seen among hikers and trekkers. And blisters can be painful and may cause discomfort. Ayan. So raise your hand, no? Kung kayo ay nagkaroon na ng ganito. So in layman's term, ang tawag dito is lapak. Ayan. So kapag yung shoes mo and yung paa mo is hindi bagay sa isa't isa, yan, ganito yung nangyayari. Kaya isang lesson sa inyong lahat na kapag po hindi po pwede, wag nang ipilit at masasaktan lang kayo. Char. Okay. Place a piece of adhesive over affected area. Donut-shaped moleskin helps when blisters are at the bottom. And if blisters have popped, wash area with soap and water and put antibiotic cream. Yan. So yan po yung mga kailangan natin. Do not pop blisters po. Kasi it could really, went wrong. No? Pwede siyang mapamali, pwede kayong magkasugat pa. Alright? So imbis na mapagaling kayo, lumala po tuloy. Alright, so I guess this will be the last slide. Burns or scalds. Yan. So burns or scalds are injuries on the skin caused by hot liquid or heat. Yan. So if still on fire, stop burning immediately through the stop, drop, and roll. Yan, di ba? Pasok music, stop, drop, and roll. Ayan. So hindi ko sinabi dito mag-front roll kayo, ha? Wag kayo mag-stop kayo. Pag sabihin stop, do not panic. Iba kayo. Ang iba kasi is takbo ng takbo. Nasusunog siya, takbo siya ng takbo. So, you stop, you drop, and then you roll. Body roll po, no? Para po matanggal yung apoy sa ating katawan. So, take off constrictive clothing immediately. If first degree burn, yan. So, pag sabi natin first degree burn, yan po yung first layer ng skin natin is nasunog. Alright? The top layer skin is affected. Put affected area under running water or immerse in cool, not ice, water until pain subsides. If no running water is available, then apply compress. Alright? So nakakatulong yan. Cover with sterile, non-adhesive bandage or clean cloth. Do not apply butter or ointment, which can cause infection. So it's not advisable to apply Colgate sa pangapaso natin, guys. Okay? So for second degree burn, affecting the top 2 layers of skin. So medyo malala na to. Alarming siya. Immerse in cool water for 5 to 10 or for 10 to 15 minutes. Do not apply ice. It can lower body temperature and may cause further damage. Next, do not break blisters or apply butter of ointment causing infection. Katulad ng sinabi ko kanina. Protect burn with sterile non-stick bandage and secure with gauze of tape. And to prevent shock, let the person lie flat and elevate feet for about 12 inches high and elevate the burn area about heart level if possible and cover the person with coat or blanket. Wait for emergency personnel. Yeah, so those are the things that you need to remember in conducting first aid. Okay po? Just like what I've told you earlier, that the only person that you can depend on this lifetime is yourself only. All right? So mas lamang ang may alam. Okay? So if you have any more questions, you can PM me. You can direct message me on my social media accounts, or you can just comment down below. Okay? Because this will be uploaded on my YouTube to help also other students who are answering their modular instructions. Yeah, I don't know if anong tawag doon, modular. And so I hope this PowerPoint presentation helped you a lot in reviewing for your examination. And I congratulate you guys in advance. And yun, always take good care of yourselves because no one will ever will. Goodbye, everyone. I'll see you all next lesson.